Once the clinician feels comfortable with both nasal CPAP and nasal ventilation, it's time to take it one step further and introduce the NOVA technique. So here are the objectives for clinical training 2. First, you want to explain to the clinician what the NOVA technique is. Next, you want to teach the clinician how to use the NOVA technique in the OR with the Supernova device. Finally, you want to make sure that the clinician feels comfortable performing the NOVA technique on their own. You want to first start off by explaining what the NOVA technique is. NOVA stands for nasal oxygenation and ventilation of the airway. Essentially, it's a technique which allows for continuous oxygenation and positive pressure ventilation through the nose during laryngoscopy. The Supernova device, as shown here in the picture, was specifically designed to remain on the patient's face during laryngoscopy, provide an unobstructed view of the airway, and allow for continuous positive pressure ventilation. Next, we want to teach the clinician how to perform the NOVA technique. After the patient has fallen asleep and the Velcro straps are tightened and nasal mask ventilation has been confirmed, ask the clinician to place the patient on the mechanical ventilator. This will allow for hands-free ventilation in order for the clinician to perform laryngoscopy. It is important to recommend the following settings to the clinician. Have them place the patient on volume-controlled ventilation at a respiratory rate greater than 15 breaths per minute and a tidal volume greater than 500 milliliters. This will ensure an adequate volume is entering into the patient's lungs during laryngoscopy. When advising the clinician the ventilator settings for the NOVA technique, you want to recommend volume control and have them set a tidal volume above 700 mLs per breath. Also, you want a rate above 15. This will ensure that the patient is getting at least 700 mLs per breath at 15 breaths per minute. It is really important to make sure that the clinician feels comfortable with the NOVA technique. And the reason is because clinicians are not used to keeping something on the patient's face during laryngoscopy and intubation. In order to try and make them feel comfortable, you want to ask the following questions. And the reason you want to ask these questions is because you already know what the answer is going to be. First, ask the clinician if their view of the patient's airway was obstructed. We know that the Supernova was specifically designed to provide an unobstructed view. Once the clinician says, no, my view wasn't obstructed, they will be surprised, but they will also have a sense of confidence that they will continue to be able to have an unobstructed view of the airway. Next, ask them if they even noticed if the Supernova was still on the patient during laryngoscopy. Most clinicians forget that it's even there because they're so focused on the view of the airway. Finally, ask them if they felt more comfortable knowing that oxygen was continuously being delivered to their patient. What we've found from clinicians already using the Supernova is that they do feel much more comfortable knowing that there was a device that was providing continuous oxygenation and positive pressure ventilation to the patient during this critical time. Finally, the more you continue to reiterate to the clinician that they will have an unobstructed view of the airway and that they will be able to provide continuous oxygenation and positive pressure ventilation to the patient, the more comfortable the clinician will feel.